And Chinese health authorities are releasing a second update on the nation's COVID-19 death count. This time, over 12,000 people reportedly died in hospitals between January 13th and 19th. That number up from the official figure of 60,000 from 1 week earlier. Is the new number credible? Let's hear from some voices inside China for more.
In the northern province of Shanxi, a doctor disclosed figures he learned about the local COVID-19 death toll. To protect his identity, we gave him a pseudonym.
More than 300,000 people live in our county. Over 4,000 were said to have died during this time. In one single village, there were dozens of deaths. Too many bodies wait to be burned. Cremation is available after 1.5 months of waiting. Prices for wreaths and coffins are all soaring. They're out of stock and hard to buy.
Li explained that many people have passed away in the region, both elderly and young, adding that some of them died suddenly while recovering from the infection.
There are 700,000 people living in the city. I heard that 5,000 have died.
In the neighboring Shanxi province, a resident gave more details. He explained that usually local funeral homes only need to work in the morning to meet demand. But now people line up outside the buildings at night, waiting for the next day's cremation services. And that's not all.
A new funeral home was built here, with several furnaces burning non-stop, and a decommissioned crematorium was reopened. In rural areas, if there's no place for cremation, villagers simply bury the deceased in the ground.
A funeral home in southeastern Jiangxi province revealed more on Chinese social media. The source said that in previous years, the number of deaths in the country totaled less than 100 in December. But last month, the figure was over 6,000, a whopping 60-fold increase.
And new reports coming in from citizens in China, farmers from several regions told NTD about what's actually happening locally. They say many elderly people in their communities have died from COVID-19. Here's more from one of them in China's eastern Zhejiang province.
Many elderly people living in rural areas died this year. Some of them committed suicide because they couldn't put up with the pain after being infected with COVID-19. In my village, one elderly person jumped into a river. Another in a nearby village jumped into a pond.
Yang said there's also a drug shortage in local hospitals and that those infected with the virus struggle to get medical treatment. In China's southern Hunan province, a farmer said 5 people in his social circle died from the COVID-19 virus.
Within my brother's social circle, 10 died from the virus.
And now moving on to North China's Hebei province, a woman there said a father and son living in her residential compound both died from the virus on the same day.
The father died in the morning and the son passed away in the afternoon. It's so sad.
Bao explained that her local funeral home was overflowing, so family members now must transport their dead to another nearby crematorium.